Dear friends, in previous session we have discussed about the definition and importance of nursing research. In today's session I am going to discuss about the purposes of research and nursing research. Yes, the main and most important purpose of research is to bring modification in known things or procedure or to solve the existing problems in the profession or invent new things to improve the professional standards. Likewise, the main purpose of nursing research: number 1, clearly identify a phenomena which is little known. There are many factors or phenomena which we are knowing very little, such as some disease like Ebola, Corona, Dengue, etc. We don't know in these diseases some people are surviving even they diagnosed positive, some are showing little signs and symptoms, and some are mild and some are severe, and some people lose their life because of these diseases. If we are going to do study on such problems, we can able to know clear phenomena of such kind of diseases. The next main purpose of nursing research is to describe about a phenomena. Yes, in nursing most probably we are going to describe about a particular phenomena. For example, patient conditions. Yes friends, we all have experienced while working in a hospital that when patient is in normal or general ward, a patient blood pressure level will be found to be normal, but when he will shift to pre-operative ward, then his BP will be high. Why it is like that? Because the patient is under stress. Here we can describe the coping strategies or coping modalities of patient with pre-operative stress. This phenomena we can describe in detail and help to study further to find out the solution for this particular phenomena. The next purpose of nursing research is to exploration of phenomena which is little known. Yes friends, we are not only describing the phenomena but also explore it. For example, here we can take hypertension or patient suffering with cardiac disorder as an example. First, what we will do? We will describe the phenomena, that is how the patient got the cardiac disorder. Then we are going to explore the factor which all are responsible to get this disease. Means we are going to analyze the previous lifestyle of patient. That is, we identify the causative factors for cardiac disorder. Not only causative factors but also going to explore the associated factors such as smoking, drinking alcohol, sedentary lifestyle and so on. So, exploration of related things help us to study the problem deeply and find out the root cause of the problem, which in turn help us to solve the problem. The next purpose of nursing research is explain of phenomena. Yes, by doing research we can explain phenomena. That is, to explain here the investigator must ask the questions himself such as what is the phenomena, why it is important, why I am going to study this phenomena, what I am really going to test in my study, when do I study the phenomena, where do I study the phenomena, where do the phenomena exist, where do I get the samples for my study, how do I choose the samples, whom all I am going to include in my study and so on. If you go on answering the such type of questions, then automatically you go on explaining the phenomena. The next purpose of nursing research is to predict and control. Yes, we can predict the situation based on study results done on similar problems and take precautions before it appears. For example, diabetes. The majority of studies says that the population is under risk get this disease is above 40 years. It usually affects the people when they cross 40 years of age. Then what people will do? They start taking precautions against that particular disease. That is, they start walking, doing exercise, controlling their diet, etc. to maintain their blood sugar level. So this we can understood that the study result help us to predict the future and upcoming problems and help us to control them by taking precautions. Hence, these 5 are the main purposes of research as well as nursing research. I hope all of you understood the purpose of research. Dear students, while watching video, please try to note the important points or take the lecture notes. Otherwise, watch the video again and again for better understanding the concept. Next, let us discuss what is the role of nurse in nursing research. The role of nurse in nursing research are as follows. The first one is the nurse acts as advocate of client or respondent during the study. Yes, we already discussed this point in previous session, and here the nurse act as advocate means the nurse is going to take decision regarding participation of client in the study. The next, nurse act as major or principal investigator in the study. Yes, in research, investigator may take help of nurse to collect the data. For example, in larger sample and area of study, the investigator may assign a nurse as a major or principal investigator to collect the data from various regions of the setting where the investigator can't able to reach himself. Otherwise, the nurse can do the study on particular problems or on particular patient acting as a principal investigator herself. The next, nurse act as evaluator of a research findings. Yes, by application of research findings in her day-to-day activity or on a patient, the nurse identifies whether the results of the study are same as determined by the study or not. Hence, here the nurse is going to act as evaluator of a research findings. Next, nurse act as research problem identifier. Yes, because nurse is going to perform the various activities in her profession and come across with many patients and healthcare workers. So, she can easily identify the problems, for example, communication problem, work-related problems, and so on. Hence, she can identify the problem and take the note of that particular problem and help herself to conduct a study on that particular problem and do the research. Next, the nurse acts as informant, respondent, subject, participant or sample of a population. Yes, nurse can act as informant or study respondent because some studies can be conducted on nurses itself. For example, in a study to assess the communication barriers among the nursing staff working in X hospital. In such kind of study, nurse itself become the sample of that study because investigator collect the data from nurse itself. Hence, nurse can be considered here as a subject or a sample. The next role of nurse is the nurse act as a consumer of research findings. Of course, the study results will be used by the nurses itself. to solve the problem. Hence, they act as consumer of a research studies. Then, the next role of nurse is nurse acts as associate or member of a research team. Yes, in some time, the research is conducted by group of investigators. In such type of studies, the nurse can join the group as associate investigator or become a member of that particular research team. I hope all of you have understood the role of nurse in research. So next we will discuss regarding barriers of nursing research. The first barrier of nursing research is research related barriers. Yes, research is not an easy process. It takes time as well as require expertization. Not having knowledge about research, how to do research, where to do research, when to do research, and all will act as research barriers. Sometimes investigator may not find the sample or setting what investigator had chosen may not be feasible for study. Loss of sample or principal investigator may not yield good and acceptable results of the study. This acts as research related barrier. The next barrier is nurse related barrier. Work schedule and time, these two main factors act as a nurse related barrier because busy schedule, that is nurse is a patient caretaker, hence she won't get much time to do the study, or she may not have a good knowledge about research, sometimes act as nurse related barrier. Then organizational barrier. The organization may or may not support to the investigator to conduct the study, act as organizational barriers. Then barriers related to nursing profession. Nursing profession is still developing and here majority of people join the nursing profession blindly and they may not work for the profession or they may not try to upgrade the profession, or they will be always busy in taking care of the patient itself. This acts as nursing profession related barrier. I hope all of you have understood the barriers of nursing research. In next session we will discuss about the types of nursing research or research. Till that time, take care and thank you for being with me and listening and watching the video. Thank you.